Hey everyone, and welcome back for another deep dive. Today we're going to be tackling something you might have heard about, but maybe don't know a ton about.
Sounds intriguing. What's on the docket today?
We're taking a close look at Marburg Virus Disease.
Oh, wow, that's a pretty serious one.
It is, and to make sure we get all our facts straight, we'll be using the World Health Organization fact sheet as our guide.
That's definitely the most reliable source out there.
Yeah, so consider this your one-stop shop to understanding Marburg.
Awesome. I'm ready to become a Marburg expert.
Me too. By the end of this, you'll be able to explain what it is, how it spreads, and what we know about prevention and treatment.
Sounds like a plan. So let's start with the basics. What exactly is Marburg Virus Disease?
Yeah, like paint me a picture. What are we dealing with here?
Well, it's a pretty powerful virus that can make people really sick, and yeah, unfortunately, it can often be fatal.
Oh, that's scary. Now, I vaguely remember hearing that it's related to Ebola somehow.
You're right, they're both part of the same virus family, the filoviruses.
So they're like cousins in the virus world.
Exactly. And like with human families, they share some similar traits, like causing hemorrhagic fever.
Hemorrhagic fever. Okay, that sounds serious. I mean, how worried should we be about Marburg?
The average fatality rate is about 50%.
Wow.
But it's important to remember that this number can vary a lot. It depends on things like how early the disease is diagnosed and how well it's managed.
So early intervention is super important.
Absolutely. Things like supportive care, keeping people hydrated, managing their symptoms, those can make a huge difference in their chances of survival.
That makes me feel a bit better, knowing that there are things we can do to help. So where on earth did this virus come from in the first place? When did it first appear?
Well, the world first encountered Marburg back in 1967.
Oh, wow, that's a while ago.
Yeah, and it was a pretty big deal. There were simultaneous outbreaks in Germany, both in Marburg and Frankfurt,
Wow, two cities at once.
and in Belgrade, Serbia. So it was a global health mystery.
Ooh, a mystery. I love those. Did they ever figure out what caused those outbreaks?
It all traced back to labs that were working with African green monkeys imported from Uganda.
Uh-huh. So the monkeys were the source.
Well, at first everyone thought so, but it turns out it wasn't quite that simple.
Oh, there's a twist. I knew it.
Yep, it was later discovered that the monkeys themselves weren't the original source of the virus, they were infected by something else.
Okay, so if not monkeys, then what? Don't leave me hanging.
The real culprit, or the natural host of Marburg virus, is a type of fruit bat called Rossettis aegyptiacus.
Rossettis aegyptiacus. That's a mouthful.
It is. But basically, they're fruit bats found in Africa. And it's through human interactions with their habitats, like going into caves and mines where these bats roost, that the virus jumps from bats to humans.
Makes sense. So it's those close encounters in those dark, mysterious places. But once a human gets infected, can they spread it to other people?
Unfortunately, yes. Once the virus is in humans, it can spread through direct contact with bodily fluids.
Like blood.
Blood, saliva, vomit, basically any kind of bodily secretion.
Oh, that's a lot to be careful of. So it's really important to avoid contact with anyone who might be infected, right?
Absolutely. Especially for healthcare workers who are caring for patients with Marburg. They're at a much higher risk, so strict infection control in hospitals and clinics is super important.
Okay, so it can spread quickly if we're not careful. Now let's get into the nitty-gritty. What are the symptoms of Marburg? What does it actually look like if you get infected?
It usually starts suddenly, kind of like a really intense flu. You got a high fever, a terrible headache, and just feel really, really tired.
Like that awful feeling when you're coming down with something.
Yeah, except way worse. And then by about day 3, things get a lot more serious.
Oh no. Like how?
Imagine severe diarrhea, really bad stomach cramps, nausea, vomiting, the works.
That sounds awful. And I'm guessing it doesn't stop there.
Sadly, no. By day 5, you might start to see what we call hemorrhagic manifestations, which is basically bleeding.
Bleeding? Where from?
It can be in your vomit, your feces, or even from your nose and gums.
This is sounding more and more like a horror movie.
It's definitely not a pleasant disease. And to make matters worse, the virus can affect your central nervous system.
What does that mean? Exactly.
Well, it can lead to confusion, people becoming easily agitated, and even some aggressive behavior.
Wow, that's really scary. With such serious symptoms, you'd think it would be easy to diagnose.
You would, right. But it's actually trickier than it seems.
How so?
Because the early symptoms of Marburg can look a lot like other diseases, things like malaria, typhoid fever, or even other types of viral hemorrhagic fevers.
So it's like a master of disguise.
Exactly. It can really throw doctors off. That's why they need to run specialized lab tests to confirm whether it's actually Marburg.
Wow, so it's like a medical detective story.
Hmm.
So let's say you get the bad news. The test confirms you have Marburg. What happens next? Is there a cure?
That's the tough part. Currently, there aren't any approved vaccines or antiviral treatments specifically for Marburg.
Oh, that's not what I wanted to hear.
It's definitely a challenge, but that doesn't mean there's nothing we can do.
Okay, so what can doctors do to help?
Well, even though we don't have a cure, early supportive care can make a world of difference.
What do you mean by supportive care?
Things like IV fluids to combat dehydration, maintaining electrolyte balance, and just managing those really awful symptoms.
So it's all about giving your body the best possible chance to fight it off.
Exactly. And there's some good news on the horizon. Scientists are hard at work developing promising treatments.
Like what?
Things like monoclonal antibodies and new antiviral drugs. These are still under development, but it's definitely a reason to be optimistic about the future.
Oh, I'm so glad to hear that. So it sounds like there's a lot of research happening to find better ways to treat this virus.
Oh, absolutely. It's a very active area of research.
That's reassuring. But we also mentioned that it wasn't just monkeys who could get infected. What other animals are susceptible to Marburg?
Well, we know that African green monkeys are susceptible, which is how those initial outbreaks happened, but researchers are also looking into the role of pigs.
Pigs.
Yeah, they could potentially act as what we call amplifier hosts, meaning they could help the virus spread more widely.
Whoa, so it's like a whole ecosystem puzzle we're trying to solve.
You got it. Understanding how the virus interacts with the different species is crucial to getting a handle on this disease.
Okay, so we've talked about what Marburg is, where it comes from, how it spreads, and the challenges of treating it. But now I want to know, what can we do to protect ourselves? What steps can we take to avoid getting infected in the first place?
That's the million-dollar question, right? And the good news is that knowledge really is power when it comes to staying safe from Marburg.
So the more we know about it, the better equipped we are to avoid those risky encounters.
Exactly. Understanding the risks and how the virus spreads is the first line of defense. So let's break down some simple steps you can take. So first and foremost, avoiding contact with bats is key.
Right. Makes sense. Stay away from the bats.
Exactly. So no exploring caves or mines where they might be hanging out.
Gotcha. But what if you live or work in an area where bats are common? I mean, you can't just avoid them completely.
Well, in those cases, it's all about being super careful, especially if you're handling any animal products like meat.
Ah, right, because bats can sometimes transmit viruses to other animals too.
Exactly. So if you're preparing meat, make absolutely sure it's cooked thoroughly. Heat can kill the virus.
Got it. So no rare bat steaks.
Definitely not. You want to make sure it's cooked all the way through, just like you would with chicken or pork.
Makes sense. So basic food safety rules apply here.
Absolutely. And on that note, good hand hygiene is also crucial.
Of course. Hand washing is always a good idea.
It really is. It's one of the simplest yet most effective ways to prevent all sorts of infections, including Marburg.
Right, we've all become hand washing experts these days.
For good reason. Now, let's talk about what happens if the virus does spread to humans. What can we do to contain it?
Yeah, because we know it can spread through bodily fluids, so how we stop it from spreading further.
Avoiding close contact with anyone who might be infected is essential.
So if you know someone is sick, stay away.
Right. And for healthcare workers who are treating Marburg patients, that's where those strict infection control measures come in.
Yeah, because they can't exactly avoid contact with their patients.
Exactly. So they need to wear the proper personal protective equipment, gloves, gowns, masks, eye protection, the whole 9 yards.
Like suiting up for battle?
Pretty much. They need to create a barrier to prevent those bodily fluids from getting on their skin, in their eyes, nose, or mouth.
I can see why that's so important.
Yeah,
It's better to be overly cautious than to take any risks.
absolutely. And another key part of infection control is safe injection practices. Always use a new, sterile needle and syringe for every injection.
That should be standard practice anyway, right?
It should be. It helps prevent the spread of all sorts of bloodborne pathogens, not just Marburg.
Right, so it's a good habit to have in general.
Oh.
But let's shift gears a bit. What about people who do get infected? What are their chances of recovering from Marburg?
Well, While the fatality rate is high, it's important to remember that many people do recover.
Oh, phew, that's good to know.
And the good news is that most survivors develop immunity to the virus.
So they're basically protected for life.
For the most part, yes, but there have been rare cases where the virus has reappeared even after someone has seemed to fully recover. We call this a relapse.
A relapse. Oh no, I thought once you beat it, you were good to go.
Unfortunately, it's not always that simple, and there's another wrinkle to this. Sometimes the virus can linger in certain parts of the body, even after a person seems to have cleared the infection.
Wait, really? Where can it hide?
Think of it like this. There are certain places in the body where the immune system doesn't have full access.
Like what?
Places like the testicles, the inside of the eye, what we call immune-privileged sites.
So it's like the virus is playing hide and seek in your own body.
Kinda, yeah. And this raises some important questions about the long-term health implications for survivors.
Right, because if the virus is still hanging around somewhere, it could potentially cause problems later on.
Exactly. We know from studying other fellow viruses that Marburg can persist in the placenta, amniotic fluid, and even the fetus of pregnant women who are infected during their pregnancy.
Wow, so it can potentially affect unborn babies as well. That's really concerning.
It is, and it can also be present in breast milk.
So there's still so much we don't know about the long-term effects of Marburg.
That's why ongoing medical care and monitoring for survivors is so crucial, even after they've seemingly recovered.
Makes sense. They need to be closely watched to make sure everything is okay.
Exactly. Now let's talk about another tricky aspect of recovery. Can someone who's recovered from Marburg still transmit the virus to others?
That's a good question. I assume that once you're better, you're no longer contagious.
It would make sense, right? But unfortunately, that's not always the case.
Oh,
There have been documented cases where Marburg virus has been transmitted through semen even after a person has recovered.
wow. Seriously.
Uh,
So even if you feel fine, there's still a risk.
It is a possibility, especially in those weeks or months right after recovery.
Wow, that's something people definitely need to be aware of.
It is. The WHO actually recommends that male survivors enroll in a semen testing program.
To make sure they're no longer shedding the virus.
Exactly. It's for everyone's peace of mind.
That makes sense.
Mhm.
And until they get those negative test results, using condoms is probably the safest bet.
Absolutely. It's all about minimizing any potential risk.
Right, better to be safe than sorry. So we've talked a lot about what individuals can do, but what about the global response to Marburg? What's being done on a larger scale to fight this virus?
Well, when it comes to the global response, the World Health Organization, the WHO, really takes the lead.
Right, they're like the Global Health Authority.
Yeah, exactly. They work with governments all over the world to, strengthen their preparedness and response capabilities when it comes to Marburg.
So they're helping countries get ready in case an outbreak happens?
Exactly. Think of it like helping them set up early warning systems, kind of like a radar so they can detect cases as quickly as possible.
So they're not caught off guard?
That's the idea. And they also help develop response plans so everyone knows what to do if an outbreak does occur.
So it's all about having a plan in place ahead of time?
Absolutely. It's much easier to manage an outbreak if you're prepared.
Makes sense. So the WHO is kind of like a coach getting everyone ready for the game?
Yeah, that's a good analogy.
Yeah.
But they don't just, stand on the sidelines once an outbreak happens.
Right, they're more hands-on.
Exactly. They jump in and help with things like case management, contact tracing, and making sure infection prevention and control measures are in place.
So they're right there in the thick of it, working with countries on the ground.
Absolutely. And one thing they really emphasize is the importance of community engagement.
Right, it's not just up to governments and health organizations.
Exactly. It's about empowering individuals to understand the risks and how to protect themselves.
So education is a powerful tool in this fight against Marburg.
Oh, for sure. When people understand how the virus spreads and what steps they can take, it can really slow down transmission.
So it's all about giving people the knowledge they need to make informed decisions and stay safe.
Exactly. And the WHO also looks at bigger picture stuff, like improving access to healthcare and sanitation, and even promoting safe burial practices, all of which can help reduce the risk of outbreaks.
So it's a really comprehensive approach, tackling the problem on multiple levels.
It has to be. There's no one-size-fits-all solution to a virus like Marburg. It takes collaboration, commitment, and a global effort to truly get ahead of it.
Well, we've certainly covered a lot of ground today. It's been a fascinating deep dive into the world of Marburg virus disease.
We have, and it's clear that it's a complex and dangerous virus, but
But there's hope.
Exactly. There's so much research happening and new treatments are being developed all the time.
That's really encouraging to hear.
It is. And in the meantime, the best thing we can all do is stay informed, stay curious, and take those steps to protect ourselves and our communities.
So the takeaway message for our listeners is, knowledge is power. Understanding Marburg is the first step to staying safe.
Couldn't have said it better myself.
Well, that brings us to the end of our deep dive. Thanks for joining us on this journey. We hope you learned something new and feel empowered to stay healthy and safe. Until next time, everyone.